My name is Stephen Arroyo, owner of TheraSport Physical Therapy. I've been in practice for about 18 years total, 17 years with the company that we started here. What attracted me to physical therapy is I've always been involved in athletics and martial arts, and there's a lot of carryover between how the body moves to do those kind of activities versus how you try to move the body to help rehabilitate. Also wanted to work with people and be active as far as trying to not be behind a desk with paperwork, because my father's job was like that when I was growing up, and I knew I didn't want to do that. So being able to interact with people, being able to help people, and being able to work with the body was something that interested me as far as the physical therapy field. After these 18 years of practice, some of the most common injuries that you see in both men and women, together, shoulder injuries and spine injuries are probably the most common thing that you'll see for several reasons. One, the shoulder is a very unstable joint. You have a lot of mobility in it, but it does not have a lot of stability because it has so much range of motion. So that's a very common injury. Rotator cuff injuries, different shoulder pathologies. Spinal problems are extremely common as well, for the simple fact that our society is such a forward flex society that puts constant stress on one area of the spine while not going the other direction to help unload that stress. As far as women go, women are a little bit more susceptible to some of the knee injuries than men are, but it's another joint that we see a lot in both men and women. The women have more susceptibility to knee injuries because their pelvis is broader, and that broader pelvis puts a sharper angle down on their knee, which puts a greater stress on their tissues as far as the ligaments go, gives them a greater risk for ligament damage like ACL tears, and contributes to problems like patellofemoral pain syndrome where the kneecap's not tracking right. So these are probably the most common things that we see: shoulder, knee, spinal issues, just because those joints rely so much on muscular stabilization. Something in general I'd say about physical therapy that most people should know is that the concept is not just to get you over the initial injury that you have. So when you go to therapy for an injury, for example, like, a lot of people have recurrent issues with their back, and it'll come and go, come and go. When you go and have physical therapy for a spinal problem, the concept is this should be the last time you have to treat this. The idea is to fix it right, and then do things down the road so you don't have problems again. We see so many times where people have issues repeatedly, and other joints as well, with the shoulder, with the elbow, with the ankle. The goal of therapy should not be just to get over this issue so you can kind of get back and do what you want to do. The idea should be to get done with this issue and never have a problem with this particular pathology again in the future. That's kind of the goal that we try to follow. Is physical therapy only for people who have injuries? Well, there's kind of different answers to that question. A lot of people, after they have surgical intervention, therapy is necessary. It's an important thing to help recover the range of motion, strength, and proper function of the joint after you've had a surgery, because those are some of the collateral issues that you might have after having some kind of a surgical procedure. You see it a lot with people when they do have injuries, for example, like a sprained ankle or when they've had a ligament injury in their knee. But certainly physical therapy can help with some structural deformities. One of the things that would be much better if our insurance practices would allow, the only people that got medicine right, in my opinion, are dentists, because dentists promote preventative maintenance. A dentist doesn't wait till you have a cavity. They have you come in and check them out and see if you have a cavity, make sure that you're not leading towards these kind of problems that are going to cause more expensive and more invasive procedures to help correct. Well, I think physical therapy kind of could be and should be the same way, where you would go in and see a physical therapist maybe once a year or whatever, and they could look, because there's a lot of things you could look at structurally that would be setting you up for an injury. So in that regard, physical therapy could be very helpful for people where they don't have injuries in order to help prevent future injuries. And have, somebody comes in, you look at maybe you look at their knees and you say, man, this angle of your knee is going to set you up for a patellofemoral dysfunction. If you start doing these stretches, do a few exercises like this, it should help prevent it. That would prevent a lot of problems down the road and even bigger injuries where they might need surgical intervention. The problem with that is we have a hard time with insurance paying for the treatments that they need after they've had injury, much less paying for preventative maintenance. So it would be a great tool to help prevent, an ounce of prevention is worth a pound of cure kind of thing. It would be a great tool, but the problem is I don't see society welcoming that, especially from the insurance standpoint. Strategies for preventative care, as far as men, women, or children go for that matter, there's three pillars to orthopedic health. There's flexibility, there's strength, and there's proprioception, or what we refer to as balance. The problem with a lot of what we do from an athletic standpoint, even from just a general exercise standpoint, focuses solely on strength, and you kind of lose sight of the proprioception and of the stretching. And so one of the best things, I think, as far as injury prevention, yoga is really good because it does work on all those three things. It works on strength for the upper body, which is where people get too weak. It works on flexibility for the lower extremities, which is where people get too tight. And then it works on balance, which helps prevent falls and helps keep the muscles reactive as they're supposed to be. So yoga is a real good thing, but any kind of program where you're doing a little bit of stretching, a little bit of balance, and a little bit of strength would offer the same. If you didn't want to go to yoga class, you could work on those same three things and help prevent injuries, because all injuries are typically due to a deficit of one of those three structures, either deficit in strength, deficit in flexibility, or a deficit in your proprioception. Differences between a physical therapist and like a personal trainer is really just simply the education that they go through and the standpoint that they try to direct you towards. A personal trainer, the certification course is very limited, and they don't have as much of a knowledge base as far as the anatomy, physiology, and certainly different pathologies, both systemic and localized pathologies as far as injuries are concerned. So they may attack it as simply just looking at it from, hey, we're going to strengthen a tissue, whereas a physical therapist, hopefully you're trying to take in more of the systemic role. You're looking at, the person's overall health care. Is there a diabetic condition involved? Is there something else that's going to limit how they should function? Is there a spinal pathology that's going to dictate how they need to address their knee issue? Is there a cervical issue that's going to address or conflict with how they're trying to address their shoulder? So yeah, both people work on strengthening. However, you should have a significant greater view of the human body as a whole and a greater level of training and knowledge as a physical therapist, because you go through a significantly greater amount of schooling. I think that physical therapy is essential from the standpoint of one injury can be very bad for somebody depending on the significance of the injury. But what really gets most people, and treating the population as I have with people as they're older, and as I see them older clients, and they always, I always hear stuff like, if I knew I was going to live to be this old, I would have taken better care of myself. I always hear that from people. Well, it's not the one injury that gets you so much as it is the cumulative effect of multiple little injuries. Yeah, you get a little tennis elbow and it hurts, and then you get a rotator cuff strain and it hurts, then you get a knee problem. And so this cumulative effect of injuries is what really starts to slow down your overall function, your overall ability to continue to move. And as you've heard before, that the more mobile you are, the more active you are, the better it is for your body. Our bodies are made to move like that. So that as you age, especially, that stagnation is what leads to other pathologies, both systemic and joint related. So the cumulative effect of these injuries is what can slow your whole level of activity down as you age, and that can cause a lot of other comorbidities. So I think the essential aspect of physical therapy is that when you have an injury, when there's something that comes up, like we said earlier, get it fixed and get it where it's not an issue so that you can continue to thrive, continue to move forward. Again, the best things I think you can do as far as a maintenance program is a program that has good flexibility for your lower extremities, good strengthening activity for your upper extremities, and then a little bit of aerobic and or balance activity. So if you're doing some kind of a gym program or some kind of an active lifestyle program, you'd want to make sure you're stretching your lower extremities to the major muscle groups, the calf, the quad, the hamstring. You want to make sure you're strengthening the upper extremities, your shoulders, and your elbows and your wrists. And you want to make sure you're doing something for balance and something for cardiovascular endurance, which can be a stationary bike, which can be just something to elevate your heart rate for a 20 or 30-minute program. Those things should help address or cover all the different levels that could lead to both systemic issues as well as to local joint problems or orthopedic issues. If I could change something as far as how the policies with physical therapy would be concerned, it'd be, that we didn't have to deal with insurance at all. Insurance is too often restrictive of how we're able to practice, restrictive of the treatments that our patients can get, and restrictive of how much treatment they can get based on their injury. We have people that have serious knee surgeries and their insurance decides they don't need more therapy, even though the doctor that did the surgery says they need more, and we look at them and say, yeah, they need more, because they're just not where they need to be from a functional and or a strength standpoint. So it's extremely frustrating dealing with the insurance, and that's definitely the worst part of the job. So yeah, in closing, one of the things that I would say to ensure that people maximize their potential is, after you've had, it's definitely important, in this state too, you have to really have a prescription from a doctor in order to have physical therapy. You can go to a therapist a few times without it, but for insurance to pay, of course, you have to have a prescription from the physician. So a couple things, if you have a pathology that you go to a doctor for, or you have something that's bothering you from an orthopedic standpoint, and you go to the doctor and they just, say, well, take an anti-inflammatory, which can be very helpful. It's important to inquire, hey, could physical therapy help this as well? Because that's a more natural, you're not using stuff in your body. It's something that would help to reduce the problem, reduce the pathology. So physical therapy would be a good tool to ask about, even if your doctor doesn't recommend it, because sometimes they just not are familiar with how much it might be helpful. And sometimes they'll say, oh, it's actually a good idea. The other thing is, if you've had an injury, if you've had a surgery, make sure you complete your physical therapy. Get to the point where you can get back to your function at 100% without any limitation, so you don't have a nagging issue that gets worse down the road. And if insurance does not allow you to do that, look for that tertiary level of care by getting a program you can take to the gym. Any therapist should be able to help direct you as to what you can do in the gym to help complement or help extend what you've been doing in your rehab program, so you can reach that level where you're not having residual symptoms that are going to cause complications. Because a residual symptom that you have in your knee may eventually start to affect your back, may eventually start to affect your ankle. It's a kinetic chain. Your whole body works as a chain, so everything affects everything else. And if you do not get one structure where it needs to be and you try and go back to your prior level, the likelihood of it causing issues down the road is higher. Is that good?
Yep.
All right, good.